I want to talk about something that's very, very common but very unknown. And it has to do with the connection between your liver and right side shoulder blade pain. Now, if I'm going to face this way, this is my right side over here, we have the scapula looking from behind. Here's the spine. Here's a muscle, okay? This muscle is called the rhomboid. It brings the scapula inward and upward that way. You have a little muscle right here. It's called the levator anguli scapula. Now, if you have pain right in this space, right here, or up here, or right down here, chances are it's the liver. The liver is the most common source of this referred pain. But people don't connect the dots because they think the problem is right here, and they'll swear it's from maybe just bursitis, tendonitis, or some injury, when in fact they never really had an injury in that area, possibly. Now, this could also be the gallbladder or the bile duct, because when the gallbladder has stones or it's congested or there's some blockage or irritation in the bile duct, that can irritate a nerve called the phrenic nerve, and you have two of them, and it can shoot up right here and cause a pain up on the right side and definitely up here. So if it's more up here, usually it's more gallbladder. Down here, it's more liver. Now, if it's on the opposite side, it could be more pancreas. But both of these problems are related to digestion and food. Take a look at a couple things that could cause a liver problem. One is inflammation. You ate something that created some inflammatory response, either in your liver or the gallbladder. Or you have a fatty liver because you're consuming too much of some of these foods right here, and then there's not enough space in there. It just keeps getting bigger and bigger and bigger, and it refers pain right back here. Now, I personally had right shoulder pain and right rhomboid pain for 12 freaking years, and I had no idea it was related to my liver. In fact, I went to chiropractic college hoping that I would get it fixed, and after a million treatments, nothing worked until after I graduated, and I eventually figured out what it was, and I changed the diet, and all that pain mysteriously went away. I wish I would have known what I know now back then. So alcohol can mess with the liver. A high-carb diet will do it. Too much iron can cause irritation, inflammation, and cirrhosis of the liver. Vegetable oils, okay, or medications can do it too. Check this out. Now, if we compare back in the 70s to present time, and we look at the amount of grain consumption, we had an increase of 29%. So that's an average of 122 pounds of grains per person per year in the United States. Now, I definitely don't consume 122 pounds at all. So someone must be consuming a lot more than that. But this doesn't really compare to these next two. Check this out. In the 1970s, we consumed 4.9 pounds of corn. And I'm talking about corn products or corn oil or corn sweeteners, as in high fructose corn syrup. Now, if we compare that to present time, 14 pounds. So we went from 4.9 pounds to 14 pounds. That's 3 times more. That is an incredible amount of corn that people are consuming. But check this out, vegetable oils, right? Which are really grain oils. 12 pounds in the 70s. Now it's 36 pounds. That is the spike 3 times. That is a crazy amount of vegetable oils, which, by the way, these are both GMO and they're highly inflammatory. They could potentially irritate the liver, the gallbladder, and create this pain. If you're new to my channel, you should definitely learn about something called healthy keto and intermittent fasting. It can help you. I put a link down below. But if you want more information about the liver and what to eat, I put that video right here. Check it out.